First and foremost, I think I would identify myself now as a mother, and of course, these identities change over time. But I'm a mother. I am um, a, I would say I'm a supporter. I love helping things grow, whether that's kids, dogs, plants. I love watching things grow. I'm Korean American, and um, I think I'm an advocate for those who are suffering in silence. When I was growing up, I didn't really know any physicians. My family had a liquor store outside of Baltimore, Maryland. And my father, our liquor store was often robbed. And at one point, um, it became violent. My father was assaulted and kidnapped, and he was put in the shock trauma. And it was my first time being exposed to the healthcare field while he was in the hospital. Um, while he was in hospice, he passed away. When he was in hospice, I remember just seeing all the physicians, the nurses, those NG tubes. You see everything there. And at his bedside, when he was actually dying, all the family, we were all there because he's Buddha. Our family, he was Buddhist, and there's a Buddhist belief that when one is passing away, they need to be surrounded by a positive, calm environment, and also their family, their friends or loved ones to help them kind of into the next stage of their life, the transition to the afterlife. And we weren't allowed to do that because the physicians kept pushing us out, and there was a lot of chaos. And I just remember at that point thinking, I wonder if there's something I can do in the intersection of healthcare where that matches kind of the cultural aspect, and just seeing the humanity in people. It did. Before that, I wanted to be a waitress. for, for most all of my childhood, I would wear the little waitress apron. I would go around taking orders for people. But that was, in this Korean American culture, my parents were immigrants from Korea. And so my brother is older. He's the oldest son, and he got most of the expectation of the family to do well in school. And I didn't have a lot of expectation placed on me. So it was, you know, actually a lot of my family in Korea, they were very upset that I wanted to become a doctor because they thought nobody would marry me.
Yes.
Yeah, so I have both kind of domestic and then the international because my work is in global mental health. So within ACAP and the APA, I really just love serving on committees. So just joining various committees, people kind of, after a while, I pull you into things. And it's nice to, especially during the pandemic, it's been nice to have these touch points where I see people, like you and many others, where we see people only on these committees doing the committee work or at conferences every year. I mean, the best part about conferences is seeing friends that you only see once a year.
Yes.
And it's just a nice family kind of community uh, that I've really appreciated. I am a advisor to Save the Children Denmark. So they have a carve out. It's called the MHPSS Collaborative, and it's basically a humanitarian think tank for children and families in university around the world. So they are the think tank. They do a lot of the policies, the research, the advising for most of the major UN organizations and humanitarian organizations. And then I also I am a consultant for UNICEF. So right now I have a couple of UNICEF projects that I'm doing. And then there's this committee called the Interagency Steering Committee, this IS committee, which is kind of the highest level forum for UN coordination of care. And so I'm on one of these subcommittees for children and families in humanitarian settings. The stories around children and being a child psychiatrist, so much of them are with, patients that we see, of course. But it's also just one of the reasons why I love being a child psychiatrist is it's so useful. to everybody, to your own families, like to as a parent, it's helpful. It's to my nephew and nieces, it's helpful. To my neighbors, my colleagues are always, even my psychiatry adult colleagues are asking me, or just like, hey, my daughter is going through this. What do you think about it? And it is so rewarding to be able to help and say, like, don't worry about that. It's okay. Or, I really think we might want to keep an eye on this and maybe see somebody about it. I think that to me is actually one of the most rewarding parts. And then of course, always helping kids. I work with a lot of refugee kids who come as newcomers. So they're within the first 6 months to 1 year of coming into the US. And those kids, especially during the pandemic, it was so difficult for all of us, for all kids, but to deal with the level of isolation and uncertainty and the bullying as well that they had online, and trying to figure out the online education, the remote school, it was just a level of daily hardship that I hadn't seen before. And so being able to be a consistent, stable person who's there and trying to be the umbrella and coordinating and figuring out how to help a nice, what I call like an enabling environment for the child. And to see them kind of grow within that structure and support is just, it's a gift, really. I think there are two. One is the professional aspect, of course, which is you're always in demand, and the field itself is in adolescence. There's a lot, if you're interested in research or clinical or whatever it may be, or advocacy policy, there's so many avenues that you could just take and really change the course of the field, because it's relatively new-ish. And I would say personally, it is so beautiful to be able to see the world through a child's eyes, right? To try to understand their perspective and just to be able to experience that on a daily basis is so refreshing. It keeps me young. It helps me feel more connected to the next generation and just inspired by them. When the rest of the world, there can be a lot of difficulty, of course, in the world. It's very inspiring and very grounding to be able to work with kids in this way. Oh gosh. Well, I mean, they're all related. I think one, oftentimes I'm invisible. And that is, just there's this assumption that I'm this model minority. I have lots of degrees, some very fancy places. But the model, and so there's this myth that I am this model minority and very studious and all of that. And I often feel invisible, like I could be replaced very easily. I also look very young. I used to look really young before some gray hairs. I remember a lot of patients would think, their parents would think that I was the patient, not the physician. And so it becomes this, like, oh, do you really know what you're talking about? Or like, are you just out of training? And the model minority myth and the being invisible, I think that, just to be aware of it. And I mean, we can feel it. You can feel when someone has their own preconceived notions of how we are. And I think just speaking to people like humans, right? So telling them about how I like go kite surfing and how I actually dropped out of medical school, and just to help give some texture and personality that, like, I am a real person too. I'm not just this kind of doll or a robot. I'm an Asian American physician. And then as far as it is pretty common that people will say, that I look so young, or, are you just out of training? And that one is fairly easy because I'll say, I'll tell them many Asian women look the same until they're 60 or 70, and then we just get a perm. But that it helps with kids because kids feel less threatened because, I look a little bit younger. But the parents like my training. So an experience. So sometimes I can talk about that. And I speak differently, of course, when I'm with kids than I'm with parents. That helps. I would not be where I am today without my mentors. So, these are people like when I was in my residency with Rabbi Apfel and her husband, they saw something in me that I didn't. I think that all of my mentors, uh, whether it's them or my PhD program in Amsterdam was with Joop de Jong, um, these are people who see something in me that I don't see, and they really support me and foster. And I think they see what my biggest limitation is, which for me, I'm very much introverted. I just want to do my work and, be a good person, and that's I'm fine with that. But these are people who really see that I might be limiting myself and maybe not really embracing who I am. And so they push a little bit, very kindly, very gently, and they're supportive, especially when there are life difficulties like we all have. I think they are people I could go to when something was going on. Like my mother had breast cancer and I was, a little off kilter. And they're the ones who will invite me over for dinner at their house just to treat me as a person, and get to know me. And they have been really instrumental in my career and just personally. If you're looking for work that will speak um, to purpose and to meaning, and also will allow you the flexibility to take care of yourself and to pursue your interests, um, to write. I'm writing a book right now. You can do policy, you can do research, you can do, I mean, there's so much one can do. Um, if you're looking for all of that, then it's an amazing field for you.